Raina sirचं डबल दिसतंय. What is it?
मॅम ते दोन डिव्हाइस पण ते म्यूट आहे. आय थिंक ते लॅपटॉप आणि हे दोन्हीवरनं एका याने जॉईन होता येत नाहीये म्हणून. सजदे मॅमचं पण आहे, पण ठीक आहे त्यांनी एका याच्यात केलंय बंद. माला मॅम, कॅन यू हिअर अस?
Yeah, I can hear you.
Okay, ma'am. But ma'am, we cannot see you.
Good evening, Malaji. Can you start your video, please?
नंदकुमार रेकॉर्डिंग स्टार्ट करता. Okay, we'll be starting in a minute. Ma'am is here.
Hello.
ओके, ते आपण दोन डिव्हाइस वरून झालेत.
He's trying to rejoin.
सुरेश पण दोन ह्याच्यावरनं झाले जॉईन.
Hello.
Hello, ma'am.
Can you see me? Can you hear me?
Yeah.
Yes, ma'am.
ओके.
Share the device. I think I'll have to go out and rejoin.
Okay, fine. Good, good. Again, Yashoda, is she on two devices?
Yes, ma'am. She's from phone as well as she's from the laptop.
Yeah.
Hello.
Yes,
Hello,
ma'am.
good evening, ma'am.
Yeah, this is better.
Yes, ma'am.
Yeah, thank you.
Okay.
Yeah, sorry it got delayed a little. Some
No
urgent
problem,
calls came.
Okay. Ma'am, you can. So, are you on the? Are you using laptop or phone? Because I'm able to see both the devices. Okay. Okay. Once. Okay. Right. Ma'am, should we start?
Yeah, Mala ma'am, are you
Yes,
ready?
please. Yes, please start.
Can you
Okay.
start your video?
Yes, ma'am. Please start the video.
Yes, should I start?
No, ma'am.
Hello?
Ma'am, we just want you to start your video. Then I'll give you introduction, and then we will start the presentation. Right?
Yeah, my video is started.
Okay. Yeah. Okay. Great. So, good evening. My name is Yashoda Kedar Tadhe. I welcome you all on behalf of International Longevity Center India This is the fifth lecture of the webinar series, which is organized by ILCI with the gracious support of Gharda Chemicals Limited. Today we have a very eminent gerontologist and sociologist with us, Dr. Mala Kapur Shankardass ma'am. Today's topic is psychosocial impact of corona pandemic, how to cope up with the issues. So I'll shortly introduce Dr. Mala Kapur Shankardass ma'am, and then we will begin the session. Dr. Mala Kapur Shankardass is a sociologist, gerontologist, health and development social scientist. She works as an associate professor at Maitreyi College, University of Delhi, India. She is a renowned writer who has contributed in writing various articles, newspapers, magazines, and books. She is the author of the book titled Growing Old in India, Voices Reveal Statistics Speaks. She has worked as an editor for 4 different books, including Abuse and Neglect of the Elderly in India, and other 3 which were published by acclaimed publishing houses like Springer Nature, Singapore, and Nova Science, New York. She is also author of few monographs commissioned by United Nations agencies. She is editorial board member of few international and national journals. She consults for United Nations agencies at New York, Malta, India since 1997. She was involved as an expert with the Valencia Forum of Aging, with the planning of Madrid International Plan of Action on Aging, and with United Nations Program on Aging. She has been involved with WHO as an advisor on aging-related programs. She is the Asia representative of International Network for Preventive of Elder Abuse, that is INPEA. She is associated with few national NGOs. She has many presentations at national and international forums to her credits and has chaired important sessions on aging in different parts of the world. So we are very fortunate today to have you, Mala ma'am. I request you to begin the session. Please unmute yourself and begin the session. Before that, I just request all other participants to mute themselves. You can keep your videos on if you want to, but please keep yourself mute till the session ends. Thank you. Yes, ma'am. Floor to you.
Thank you, Yashotra. Thank you very much for this introduction. And I'm very happy to join in at your webinar, which you are having so frequently and touching on some very important topics. And thank you, Anjali, for inviting me. And I'm grateful to International Longevity Center India chapter for including me in their outreach programs. And you all are doing a remarkable job. Now, these are very difficult times. So webinar and our interactions through these mediums has become very important. But in many ways, I find this a good way of interacting, and because it provides us opportunities to be together. So as already mentioned, I'm going to talk of psychosocial impact of corona pandemic and how to cope with the issues. Now, this is a very important topic. So before I really begin with the subject matter, I just want to share with you the way I'm going to be covering it. I'm going to first put the issue in a context and speak very briefly about what we know from available data. I'm then going to focus on socio-psychological impacts and concerns in terms of health and social care. I'm going to then talk of impacts on those in institutions, impacts on those living at home. And we cannot have this meeting without not focusing on the solutions, on how can we talk about what is the way forward. How do we overcome the issues which are appearing at different levels? So few of my last few slides talk about solutions, about strategies, how to overcome psychosocial problems. And of course, I ended with some concluding comments. Can we have the next slide, please?
Yes, ma'am.
So I'm going to put things in a context, and I'm going to talk about it in terms of that the COVID-19 has far-reaching consequences beyond the spread of the disease itself. The disease impacts many. There are various health concerns. It affects the mortality rates. It affects many other health-related issues. But it has other impacts. And today, like it's already been decided, we are going to focus on socio-psychological impacts and a little mention of economic issues too. Now, the concern is not just to quarantine ourselves if we are affected, because the effect is beyond that. It goes and touches everybody's lives, not just the person who is impacted, but also the lives of those who come in interaction with that person. So the pandemic has many socio-psychological impacts besides medical concerns for everyone. But older people are particularly vulnerable to these for various reasons. And you are all aware of that. You are reading newspapers every day. You are watching TV every day to know that the vulnerability of older people increases because of their age, because of various comorbidities, and because of various other factors. Now, data from different countries is indicating, and I'm not giving any figures here because that's not the purpose of this presentation, but just briefly to say that older people are particularly affected by COVID-19. The heightened risks of COVID-19 for older people are evident in all national data. In 2 days, I think 2 days back, there was a big news item which was covered by various national newspapers on providing us information about the mortality rates of older people, which was much more and affected people in older age groups, 50 and above, more than it affected people in younger age groups. So therefore, older people need special attention during the COVID-19 crisis. And I strongly believe that older people's voices, opinions, and concerns are important in formulating responses. Next slide, please. So focusing on psychological impacts. Can we have the next slide, please?
Yes, ma'am. Just 1 second.
Yeah, thank you. Now, these impacts can be anything from moderate to severe. The intensity of it varies from person to person and from situation to situation. The impacts can happen to anyone and it could be anywhere. So it can happen to women, men, those residing in rural or urban areas. But but it is seen that it is highest among the vulnerable within these categories. So the vulnerability index is separate, and many of you are aware of what makes us more vulnerable. Aged people, those with disabilities, with chronic problems, suffering with mental health issues, those living alone or in disharmony with the family members, fellow residents, they are more at risk. And then those without access to different services are more prone to problems. Now, this was giving you a background of what is the vulnerability and what we should be concerned about. But let's now focus on some of the psychological problems which arise. And we are seeing it because of the pandemic. Now, of course, we must keep in mind that these are some of the issues which are there as it is when we talk of mental health issues, but they are getting more in times of the pandemic. So there is more depression prevailing, there is more stress prevailing, loneliness is felt more because of social distancing, anxiety levels are rising, prolonged homestay is making things difficult for many people. And then, of course, the poor health status is contributing to many other concerns. And what is also happening is that we are all indulging in various work activities, which in many ways were unnecessary, but are happening because of the pandemic. For example, in many places, especially during the lockdown period, we saw even now some of the resident welfare associations are not encouraging maids to come in, domestic help to do work. So people are doing work which would otherwise be done by others. And this is increasing the stress and depression and anxiety levels. And then there is a lot of concern about others' well-being. And when I say others, it is about your near and dear ones. Everybody is so concerned these days about their family members not getting affected by the virus, that it is adding on to their stress levels. And importantly, what we must keep in mind is that there is inadequate health information, especially about available services. Many people don't know which hospitals they can approach. Many people don't know which are the plasma donor banks. Many people don't know where they can go for blood test. Many people still don't know where they can go for COVID test. And all this adds on to stress, to anxiety, to depression. And what we are noticing is that in terms of psychological problems, suicidal tendencies are increasing. And this is not just among the old, but all over. Next slide, please. Thank you. So some of the social psychological special impacts are seen in terms of social isolation, which is coming with social distancing, which is more in, should be just physical distancing, but it is leading to social distancing. And when I say that, it is important for us to keep people away from us physically, but we must be socially connected through various means. And I'll be talking of some of that little later. So this isolation, which is being stressed upon, is bringing in increase in suicides, and various figures or national data are showing us that the rate of suicide has increased during the pandemic time. Now, social distancing guidelines are disturbing. Don't meet people, keep distance, don't interact, makes people very anxious about their own well-being. And there is a lot of fear of the known as well of the unknown. And there are various threats which we see happening in people's lives. And then, of course, what has happened because of the pandemic, unemployment has increased. There is a change in work environment. And this has really affected not only the work relationships, but has affected the atmosphere at home, has affected the well-being of individuals, because it contributes to various financial factors. People with getting unemployed, their income levels have come down, or people's work situation has changed, and many of them now are getting half salaries, or some of their aspects of the salary are withdrawn. For example, transport allowance, which many people were getting, have now stopped because people are working from home. And in general, there has been reduction in human activities. You're not interacting with your office people, you're not interacting with the people at different shops, you're not interacting in your daily.
Hello? Hello?
Fear that the children who are abroad, who are away from them, may not be able to visit them if something goes wrong. Share with me at times. Period started, lockdown.
Shall I call her?
How can we get over this, that something happens?
Mala ma'am, sorry to
And then
disturb.
people are not being.
Mala ma'am, ma'am,
Yes.
your voice is getting disturbed. Sorry to interrupt, but okay. Yes, ma'am, start please. You're actually, can you repeat the last two lines because it was not audible?
Okay, I think. Should I do that? Can you give me a minute?
Yes, ma'am. Yes, ma'am.
Hello?
Yes, ma'am.
Thank you so much. Yeah, sorry for this disturbance. Yeah, I think in certain parts of my house, the connectivity is not so good. Okay.
Yes, ma'am.
So the next slide, please. So I briefly want to touch upon some of the health-related concerns because these are related to psychosocial impacts. And let's just look at it in terms of the issues which are at stake. Older people experience disproportionately greater adverse effects from the pandemic. And this is because older people have various comorbidities. They have to take different sets of medicines, say, for example, for their blood pressure or for sugar levels or for various chronic disabilities. And all this affects or has a different kind of impact. So at times they have more severe complications arising out of these comorbidities. And it also then affects mortality levels. And because of this, we are seeing higher mortality among old people. Because if you look at the data which is coming in terms of deaths of older people because of COVID, it is seen that only COVID was not responsible. They did have other factors which contributed to their instability in health. And this is also happening because we are finding that there are disruptions to their daily health routines and access to care. Older people, especially who have various health concerns simultaneously, who have comorbidities, do need to keep a control on these aspects. And their regular checkups, they're going for doctor's visits, they're getting visited by doctors. All that has changed with this pandemic. So since their access to care has declined, it has led to various disruptions to their daily routines. And also we are finding, and even the government is promoting, a lot of telemedicine, a lot of digital medicine, a lot of visual interaction, virtual interactions, which older people are still not so technologically savvy. So they have difficulty in adapting to these new methods of communication. And all this is creating health-related concerns, but at the same time having socio-psychological impacts on their well-beings. And concerns that isolation would increase existing health conditions is in fact, adding on to the problem. Next slide, please. But I don't want to just say that it's a gloomy picture. I do want you all to understand and remember that there is a saving angle to it, because older people are much more resilient. If we take a general proportion in terms of mental health issues, what we are finding is that older adults are having lower stress reactivity because they in general have better emotional regulation and well-being than younger adults. Older adults as a group are more resilient to anxiety, depression, stress-related mental health disorders, which is characteristic of younger populations, because older people have more experience, have maturity, know how to handle situations, and in a nutshell, they are the supporters and they can be models for others to follow. But this is not to undermine that older adults, because of the pandemic, are not vulnerable to some social, psychological, mental health issues. Next slide, please. Now, I want to discuss with you specific categories to understand what are the different issues at stake. Now, if you look at the people who are staying in institutions, be it old age homes, be it long-term care facilities, be it in terms of senior residential places, at all of these, there are limited interactions happening at all levels. This is because of the pandemic, because of the social distancing, because of the factors which at times the government is imposing, and also at times because it is automatically happening. So we find there is reduction in staff, which impacts the health of the citizens, residents. There are curbs on social recreational activities, like, for example, movie watching, various musical programs, various social interactive activities are being stopped where it requires big gatherings. And also a lot of restrictions on diet are happening because everyday procurement of food is not being done. There are limited activities with the staff of the institutional places, and also access to medical services is affected. Many cases, doctors' visits on a regular basis. Now that is not happening. And consequently, with all these factors combined, what we are finding is that there is increase in institutional abuse, and this is having a very adverse effect on older people. I here want to state, and please remember that in some ways in India, we are lucky that our institutional abuse is not that high. But compared to some of the foreign countries, especially the Western world, where institutional living is much in practice, the abuse levels are much high. However, what we do find, even in India, there is reduction in support, and which has a great impact on socio-psychological aspects of well-being. And reduction in support is also in terms not only of emotional security, but also in terms of financial security. A lot of people, because their income levels have got affected, are not sending enough money to their parents or to their siblings who are living in institutions. And all this is creating some kind of feeling of deprivation, which is not good for the well-being. And then along with that is fear of death. As I mentioned even earlier, the fear of dying alone is very strong among older people because they feel, because of their age, they are closer to death than the young younger people. And they feel that if the pandemic would carry on for some time, if COVID crisis carries on for some time, they don't know how long they're going to live. And that fear of being alone is something which affects them considerably. Next slide, please. Now, while some impacts on those who are living at the community level or at home is same as that of institutions, but there are some differences. And I'm just going to refer to some of important issues which impact on those living at home. So stay-at-home orders are very disturbing for people who are used to moving around their complexes, who are used to going out to meeting friends, who are used to getting involved with various senior citizen activities and so forth. Secondly, for many people who now, since they are homebound, they are in close proximity of family members all the time, family relations are getting affected. That element of space, that element of being on your own, which would add on to helping relationships, has got affected with everybody being homebound. And also those who are alone with children away, or with living with grandchildren, or with grandchildren away, living just with their own adult children, whatever, the family members' equations have changed, and teleconferencing is not available to all. And even where they have provisions for Zooms meeting, for provisions for Skype meetings, provision for WhatsApp messages, not all seniors are comfortable with using that. There is some kind of inhibition which has to be stopped, as I will mention a little later. And but these kind of technology constraints are adding on to socio-psychological problems. And therefore, there is increase in health concerns with limitations on physical activities adding on to it, because people are not being able to go for walks, people are not being able to go to the parks to do their yoga activities, do their meditation centers, do satsangs, interact with each other, and this all is having impact on their health. And then while institutional abuse increases in institutions, domestic violence, abuse and neglect is also increasing at the community level. People are not being given medicines on time. People are being spoken rudely because the patience level of everybody is getting affected. People are getting more irritable with each other, in close proximity with each other, day in and day out. And then the financial difficulties which some households are facing are adding on to violence, to abuse, to neglect, and to general well-being. Next slide, please. Now, these are some of the problems which we discussed and talked about, but I do want to focus that we can overcome these problems. Let us look at some of the solutions. Because if we look at the solutions, then things are not too bad, things are manageable. And for the next few slides, I want to focus on those aspects. So we need to adopt unconventional methods to interact. And one of the examples which I've seen in many colonies, in many residential complexes, especially those who are living in close proximity to each other, and is helping people interact and communicate with each other, are balcony interactions. What we mean by this is people come out on their balconies, talk to their neighbors, find out about their well-being, just saying hello happens to lighten up their moods. All these are unconventional methods which people were earlier reluctant to do, but are now helping them in many ways to get socially connected but at the same time keep physical distances. So we need to also, at the community level, adopt new sets of activities. Earlier, people were involved in going out, spending things, time and effort in various activities which were outdoor. But now, being indoor, they need to develop new sets of activities, and this is helping. I know of some senior citizens whom I have interacted through phone calls and in various information from various senior citizen associations, that people, those who have taken to singing, people who have taken to cooking, trying to indulge in indoor games, started with more of reading, learning new skills, etc., are much happier and contented people. So by adopting these new sets of activities, many problems can be overcome. And as I said earlier, and I repeat, we need to have more emphasis on virtual meetings, on use of technology, on simple things like Skype, through Zoom, through various other WhatsApp applications, because all this reduces social isolation. Many people are using their mobile phones, but are still not familiar with different aspects of what the mobile phone can do. So we need to open ourselves to new learning. We need to open ourselves to understanding that there are various ways in which we can be connected. And it is not just a requirement only for physical nearness. There can be a lot of social connectivity through physical distancing too. So important is that whatever you're doing, you take pride in your activities, because improving self-esteem is a very important aspect to remove socio-psychological problems. You think positive, you remain satisfied with yourself, think of yourself as a unique individual. Your improved self-esteem can really help improve your overall health status. And the focus has to be on overall health. It has to be on well-being. It has to be on how to improve quality of life. Only talking of physical health is not enough. Health has many other aspects, and we must look at it very holistically and look at things to improve ourselves. So we must reduce negativity from our lives. Let's not just think of our problems. Let's think of solutions. Let's think of overcoming problems. And this negativity has to be removed from mind. But while doing that, we must always remain COVID negative, because if you become COVID positive, then things can be more complicated. Next slide, please. Thank you very much. Okay, so now, while those were the things which I would talk universally impacting everybody, I now want to talk specifically on what certain sectors, certain segments of our society. Therefore, the role of senior citizens associations becomes very important. Now, the senior citizen associations during the pandemic phase need to become more proactive, because they have to substitute for family and siblings. They have to be friends and reach out to people who are living alone, people who are having disharmony in families, and so forth. And they must be encouraging to their fellow residents. So they have to adopt a more proactive role. They must improve their connectedness with the members of their associations. The office bearers have greater responsibility, have a role to play, and they must become counselors and advisors. I know maybe some of you are from senior citizens associations and maybe holding good posts. So I would request you to become more active to take up these different roles, which are challenging in the pandemic time, but can be done and become very helpful. And they must organize virtual meetings, teleconferencing. In my locality, I find that many senior citizens have got connected with each other through these virtual programs. They are discussing various problems, they are discussing various meetings, solutions. They meet once a week through these Zoom meetings for 1 hour or half an hour, and they share with each other their concerns, and this is really helping people. And then they are very useful in arranging delivery of mobile services. Because whether it is food items, whether it is household items, whether it is medicines, whether it is medical checkups, the senior citizen associations, by being proactive, are reaching out to look after the needs of older people. And this is helping to reduce socio-psychological problems. So their help in procurement of things, not only through services, but also helping each other. I know some of the senior citizens here who are more able, who are more healthier, and who take up the responsibility on themselves, go to the shop once a week, pick up not only vegetables and fruits for themselves, but for their neighbor, then put it on the doorstep of their neighbors. So these small activities of helping each other can reduce socio-psychological problems. So there are various ways in which assistance can be provided, and there are different means through which assistance can be forthcoming. And this is very important for senior citizens to adopt these new methods of communication and interaction with their fellow members. Next slide, please. Now, I do want to share here that, yes, lots of things are in the hand of people, but the government cannot do away with not having a very active role to play in this. And how can they be active? How can they look after the interests of the senior citizens and help reduce socio-psychological problems of senior citizens, build up confidence in older people? Is that they should involve older people in decision-making through these associations. Government should include older people in policies and programs. They must have special provisions for them. Yes, we are hearing that the government is doing certain things for senior citizens in terms of healthcare services, in giving them special priority at hospitals and so forth. All these help in building confidence of senior citizens, and it helps them to maintain a better socio-psychological balance. So the government must arrange special services for senior citizens, give them priority in social and health care. And along with these health aspects, I think the government can encourage a lot of media activities to encourage spirituality, to encourage yoga, encourage meditation. So the government can enhance media activities related to positive old age issues. And I think this is one place where I feel if the government takes up upon itself to reach out to senior citizens can have better mental health. Because if we have programs which are talking about coping mechanisms, if we have programs which inform senior citizens on how to deal with their problems, the senior citizens can really feel much more mentally healthier and sort of feel satisfied with their lives. And then the role of family cannot be undermined at all. The family members, be it the seniors or be it the juniors, together in a reciprocal relationship, have to be more supportive, have to be more caring, loving, be helpful. Because if you look at any person who's happy, who is socially, psychologically mature, is sound, is healthy in mental health aspects is the one who's more cared for, is the one who's more supportive, is the one who helps others. And therefore, all these things provide emotional security. And of course, having financial security is a must. But in pandemic times, financial security can also be enhanced by bringing out income expenditure balance. Your incomes have reduced, try to cut down on your expenditures. It's not difficult. We have seen that we were earlier indulging in many unnecessary expenses. Now, with people not mixing so much, not going out much, so many things have become superfluous. We don't need them. And by cutting down on costs, our income levels can improve. So provide health security. And yes, it is very important that while you have emotional, financial health security, it helps in removing loneliness. You feel lonely because you don't feel connected with others. You kind of feel useless about yourself. And by feeling secure in other ways, you feel you are with people, you are more respected, and therefore it also helps in stopping abuse and neglect. Next slide, please. Thank you. So I'm coming towards almost the end of my presentations, but I have to talk about how we can develop coping strategies. We can reduce social isolation by digital and virtual means. I've stressed on this point many times, but I think that is the age now. We have to move on and improve our digital connectivity. Because a lot of things are being done through digital means, through virtual means, and all of us, young and old, have to open ourselves to learning this, to becoming comfortable. And it is not so difficult. I know of people who are in their 80s, who are in their late 80s also, who have taken to it. And within a little time have been able to adjust to it. So it becomes important to open yourself to new learning. And the stress has to be on meaningful relationships. It is not so important to have many interactions, but what is important is that whomever you're interacting, there should be some meaning to that relationship. Be sincere, be loving, and do that interaction with some meaning to it. So while improving access to technology adds on to it, but we also need to stabilize our economic positions, increase financial security. And this can be done, like I said, that many household expenditures have come down. People have stopped paying their drivers, people have not paying their domestic help. All this income, which was earlier going out of your pockets, can now provide you some kind of financial security. And this can only happen if we regulate and discipline our routines, and we find meaning in our activities, and therefore we remain happy and contented. Finding happiness, remaining happy, contented is a very important coping strategy, which really reduces social psychological problems. Now, some of the important guidelines, next slide, please, which I want to talk about is we need to use a very participatory approach, because we should not think ourselves as being isolated. We should think ourselves being connected with people, and we must promote each other's rights. If there is emphasis on human rights in society, we would all be comfortable. And here I want to share with you the definition given by World Health Organization on mental health, which becomes extremely important when we try to reduce socio-psychological impacts, and especially in the time of COVID. So what does WHO say? It says mental health is a state of well-being in which the individual realizes his or her own abilities. The point I have been talking about in terms of coping strategies, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So don't isolate yourself from others. Be connected. And further, the definition points out that the three core components are: one, well-being, which is very important; second, effective functioning of an individual, which is again a very important factor; and thirdly, effective functioning for a community. Because we all live as social beings, we all live at community levels, and we must be functioning at community levels also. And moving further with WHO definition of mental health, it includes subjective well-being, perceived self-efficacy, autonomy, competence, intergenerational dependence, and self-actualization of one's intellectual and emotional potential, among others. So having emotional security is therefore very important. So from the perspective of positive psychology, or talking of holistic mental health, we need to include individuals' ability to enjoy life and to create a balance between life activities and efforts to achieve psychological resilience. As I mentioned earlier also, resilience is a good factor, and many older people have that. So let's encourage it. Let's build on it. Cultural differences, subjective assessments, and competing professional theories will all affect how one defines mental health, no doubt. But mental health is an achievable goal for everyone. So we need to build on our existing resources and capacities. We need to adopt multi-layered interventions because no one thing works for everybody. And we need to integrate support systems. If we don't do that, our socio-psychological health is at stake. And it is very important that we have a strong emotional security, strong socio-psychological health. So in order to achieve that, next slide, please. I want to stress upon that it is very important for us to talk about managing information. We need to ignore reports which cause fear and panic. We need to use reliable information sources. We need to refrain from overindulgence in social media because a lot of misinformation is being provided and supplied. We must seek professional guidance and not depend upon layman perceptions. It's very good that we have a lot of free expert advice available in our country now. Many forums have started supplying this, and we must use those expert forums for getting reliable information. So we must also involve ourselves with positive outcome stories. We hear a lot about one has got affected, so one has been hospitalized, so one has such and such person went through these complications. But at the same time, if we look at our health reports, we find that our positivity rate, our people who are coming out of the illness, is quite high compared to other countries. So we need to talk more of the positive outcomes, how they have strategized themselves to fight the COVID, and how they are coming out with better health. So we need to interact with healthcare providers, and that can really help us secure mental health soundly. And what we need is to use more of counselors, to talk to people who can help us and not shy away from using these services. So next slide, please. Thank you. Therefore, we must keep it in mind that managing mental health is very important. Thinking of mental health concerns, socio-psychological issues, is as important as taking care of physical health. For physical health, we take care of ourselves with medicines, we take doctors' advice. But for psychological health, we shy away. But we should go to mental health experts. We should use more counseling services, and we should interact more with people who are equipped with giving us guidance on these areas. So we need to have a balance between normal concerns and over anxiety, because certain bit of anxiety is natural, because without that we don't look at solutions. But over anxiety is bad, and we need to normalize our life as much as we can. So we need to support general health, our diets, our temperaments, because all these normalize our health and contribute to socio-psychological well-being. And let's build on practical and emotional support. It is very important to understand what is practical in terms of our interactions and how we can derive benefits from that. So we need to get satisfaction from being care providers. We should not always be care receivers. And being a care provider can help us a lot in satisfying our egos, in satisfying our well-being. And we must understand that older people are backbone of families and relationships. Let's build on that strength. Let's show that to others. And finally, next slide, please. The last slide, please. Thank you. So I would like to conclude, I think my time is also up, by saying that we need to remain connected, have trust in people and institutions, keep control on anxiety and worry, keep away from substance abuse and use, balance income and expenditure, keep a check on health problems, postpone not so important matters. There are many things which it's not a question of now, they can be done later too. So remain mentally positive and cheerful. And remember, this too will pass. The pandemic is not there for always to stay with us. It will pass. And let's not fear it. Let's face it. So socio-psychological thing is all a bent of mind, and let us be more positive. Thank you very much for your patient hearing.
Great. Thank you, ma'am. It was really a good illustration of the problem, and you also provided the solutions. So thank you so much. Let me see if there are any questions. Kindly raise hands if you have comment or a question for Dr. Mala Kapur. Okay, sir. Yes. Udanikar, sir.
Malaji, thank you. A very interesting lecture that brought out positive as well as negative aspects of the present situation. I liked especially the part where you talked about how being positive helps. And this has been the philosophy of International Longevity Center also. We keep on advising all the senior citizens to be positive. In fact, if you look at the things, you find that today, because you don't have to travel, you have much more time available to do something more useful. So I find that I'm saving a lot of time. I find that my expenditure has gone down. I don't have to do hoteling. If I have to drink, I drink at home. I don't go to the club. The pollution has gone down. So there are certain I would say, interesting aspects of this pandemic. One small comment is regarding the fear of death. Since the death is inevitable, the only fear should be that in your obituary, they should not publish your old photograph. It should be from your college days. I think one need not fear the death at all. It's something inevitable. And I must say that in Longevity Center, we already have a program by which we are teaching the senior citizens how to use the mobiles, how to use various apps, how to use their, how to be tech savvy basically. For the last quite a few years, I must say. I think Anjali might give more details on this. And in a way, I would say that we had anticipated this need of the senior citizens. Then senior citizen clubs in Pune are very active, and I hope they take a hint from what you have shown. There are many things that they can do during this pandemic to stay connected. Another thing is the family problems. I have a feeling that in the last many years we have forgotten how to live in the family. So when the family members are not around, you feel that they are not around, and now that they are around, you feel that they shouldn't be around. So this is something I think it's psychological, and one has to change one's thinking about the family as such. But I must say, a wonderful lecture. It covered every aspect of the problem that we are facing today. And the message I take is, like you said, this too shall pass. It's like what Scarlett O'Hara said in Gone with the Wind, the last sentence, that
Yes.
tomorrow is another day. Thank you.
Thank you, sir. Yes, that was really nice. Saswati, I request you to kindly ask the question.
Hello.
Hi.
Thank you. Thank you so much for this very elaborative, detailed talk. I think it was very relatable. And it's something that we have been facing since the month of March when we got to know about this new virus. And since then, I think as younger generation as well, we also have panic that our parents fall under the higher risk group. So we also become very extra protective about our parents or our grandparents. However, from what I've noticed is my parents are not that enthusiastic to take medicines or go for tests.
Mhm.
And I mean, and because of which, there is that, and especially for kids who don't stay with their parents, they are a lot more worried about the parents. Can you please share, like, according to you, how do you convince your parents to go for a test or to take medicines, be it essential medicines, like every day you need to have multivitamins, every day you need to have certain set of medicines, so that you're more protected. I would love to know your thoughts on this. Thank you.
Thank you.
Yeah. Do you want me to comment now, or
Yes, ma'am.
Yashoda? Yeah,
You can
no.
comment.
So to begin with, thank you, Mr. Jayant. That was some thoughts which were quite what I feel, and I totally agree with you that this is what I was talking about, that we need to keep our income and expenditure levels in account, and our financial security can improve when we realize that so many of our expenditures have been cut down now, whether it's related to travel or other activities. And yes, the senior citizens associations are very important to improve the situation of senior citizens. And coming to Saraswati's point, did I get the name right? Yeah.
Yeah, it's Saswati.
Yeah. So yes, you see, this is exactly what I'm saying is that senior citizens must realize that taking care of their health is a very important aspect to face the life situations. And if they don't go for regular checkups, if they don't maintain a healthy life, if they don't keep control over their medicines or their activities and neglect certain things, it can lead to complications and be very stressful for all those who are caring for them from distance or near them. So senior citizens must realize that it is very important that they become regular with their checkups, they take their medicines in time, they listen to advice, whether it comes from children, whether it comes from experts, and not ignore their health. So yes, it is a concern to many children, adult children, regarding their parents' health, because parents are from the old generation who has looked at health from a very different perspective. And I think there are certain individuals who are more hesitant to come forward to look after themselves. But on the other hand, we do find some senior citizens who are over anxious about their health. So for every small change in their health habit, they want to consult a doctor. So anxiety levels on this has to also find a balance. And I think a lot of it depends upon how individuals react and how youngsters, the adult children, can convince the seriousness of a matter to their parents. I appreciate all the comments and whether it's through questions or in the chat box. Thank you
Okay.
all for being so active.
Okay. Yes. Thank you, ma'am. Anjali, ma'am, you want to add something? Then we will close the session. Anyway, we are learning late.
Yeah, no, I just want to thank you, Mala ma'am, for this wonderful lecture, and really we are enriched with your thoughts, because one very positive aspect that you spoke about is how the elderly themselves, though being in the vulnerable section during the pandemic, can become a source of great support for the family, and how positive they can help us remain, the younger generation, of course. Thank you so much for being here. I'm really grateful to you for this, and we hope to have some more good contributions from other experts as well, and in which we would be looking forward to your presence as well. Thank you so much. I'd also like to place on record our thanks to our supporters, Gharda Chemicals Limited, who have been helping us out with this webinar series that we've been conducting
Yes, ma'am.
over the last 2 months. Thank you, Madam Ma'am. Thank you so much.
Yeah.
Yes.
Thank you,
Okay.
Anjali. Thank you, Yashoda. Yes, thank you very much for inviting me. And I enjoyed
Yes, ma'am.
faces
Okay.
and comments on the chat box.
Yes, ma'am. So thank you,
Thank you.
participants, for joining us today. And next Saturday, we have a lecture by Ms. Anupama Datta. The details will be shared with you soon. Thank you. Stay connected and have a great evening.
She's from
Thank you.
Helpage.
Yeah, Helpage India. Okay. Yeah.
Bye-bye.
Bye.
Thank you,
Okay.
team.
Bye-bye.
Thank you.
Bye-bye.
Okay, bye-bye.
Thank you, sir. Good day, everyone.